Support for this episode comes from Dexcom. We've always been about using incredible tools like the Dexcom G7 in a way that works for us. Since Benny moved home, he's going to school and working locally now, we had some conversations about what follow looks like at age 21. For us, that means my husband follows, but just for urgent lows. I love the options of being able to adjust how we follow, in case he gets sick or he just wants more help. You can use Dexcom in whatever way works for your family. You can even share your glucose data with up to 10 people. And it's the only CGM system that still allows us to follow and still be connected to an insulin pump. By downloading the Dexcom Follow app, followers can view your glucose data directly from their smart device, whether they live down the street or across the country. Visit Dexcom.com to see how this powerful tech fits into your routine. Welcome to another week of Diabetes Connections. I'm your host, Stacey Simms. We aim to educate and inspire about diabetes with a focus on people who use insulin. This is an In the News episode where we bring you the top diabetes stories and headlines happening now. Before we dive in, a reminder, we are less than 1 month from our first Mom's Night Out of 2026. Please join us in Silver Spring, Maryland, February 20th and 21st. This is going to be so much fun. This is an event for moms of kids with diabetes and women with type 1. Next is Nashville on March 6th and 7th. And big announcement, we are going to have a Club 1921 event there as well. We just added that. That's happening Thursday, March 5th. And that is going to be for healthcare providers and patient leaders. Lots more information about all of that. Please join us. You can find out more at diabetes-connections.com/events, especially healthcare providers. If you are listening, check out that Club 1921. We just added it for March 5th. Okay, our top story this week. All UK children could be offered screening for type 1 using a simple finger prick blood test. This is according to researchers who have been running a very large study. This is the ELSA study. It stands for Early Surveillance for Autoimmune Diabetes, first of its kind in the UK. They tested blood samples from almost 18,000 kids aged 3 to 13, and they're looking for the autoantibodies. Families of kids found to have early stage type 1 received education and ongoing support. Some families were also offered teplizumab, Tzield is the brand name, the medication that can delay the need for insulin by around 3 years in people with early stage type 1. Now, the second phase of ELSA, ELSA 2, has launched and will expand screening to all children in the UK age 2 to 17. They want to assess how screening can be scaled across the country and evaluate cost effectiveness. Dexcom CEO Jake Leach says they're going to launch a new product outside the U.S. This was at the JP Morgan Healthcare Conference. He says, quote, "When you look outside the U.S., there are a lot of structures that are tiered. Patients have access to different types of products, so we've got a new one we want to introduce that will add flexibility there. It's based on the G7 platform, just like Dexcom ONE+, but it has a unique experience tailored for a subset of users that today don't have access to Dexcom." That's the quote. Your guess is as good as mine. Sounds more like a pricing or ordering issue than a new bit of hardware or software. Dexcom will also bring Stelo to some international markets this year and plans a new mobile app experience for the Stelo, the wearable biosensor meant for people who don't dose insulin. Leach also said G8 will be much smaller and have much more capability, but is several years away. New international consensus statement provides guidance for diabetes technology during pregnancy, organized by Diatribe Foundation. This is for women with type 1, type 2, or gestational diabetes. It's the first set of recommendations specifically addressing the use of diabetes tech in pregnancy. I will put a link in the show notes, just like I do for all of these stories. Bariatric surgery beats GLP-1s for type 2 diabetes across income levels. This study looked at nearly 300 patients at 4 medical centers. Success here is measured by lower blood glucose levels, higher weight loss, less use of diabetes medications, remission of diabetes to the point of no longer needing to inject insulin, and reduced risk factors for cardiovascular disease. Bariatric surgery was better than medical therapy across all social backgrounds. It was interesting because this was a long-term study that began before the popularity of GLP drugs, and by the end of the study, more people who had the choice were choosing to take the medications. But these researchers say ultimately we need large long-term studies to clarify the best strategy for a given patient. The FDA approves an update to the prescribing info for Afrezza inhaled insulin. This is a revision to the recommendations for the starting mealtime dosage when patients switch from shots or insulin pumps. This is aimed at healthcare providers. The updated labeling was supported by results from the INHALE-3 trial. The FDA is still considering approval of Afrezza for kids, a decision there expected by summer. UK researchers have developed a calculator to predict whether somebody's at risk for type 1. They're hoping this helps for screening and in preventing DKA at diagnosis. They used the long-running TEDDY study to create this calculator, which right now is in beta form and only for kids and teens ages 8 to 18. It asks questions about 4 factors: age, family history, number of confirmed autoantibodies, and genetic risk score. The calculator has been given regulatory approval as a diagnostic in the UK. These researchers are now working to bring it to the US in the next few months in the form of a home genetic test kit. Researchers in California say a father's exposure to microplastics can lead to metabolic problems in his children, including diabetes. Now, this was a study in mice, but it looked at previously unrecognized ways in which environmental pollution may influence the health of future generations. This team found that female offspring of male mice exposed to microplastics were far more prone to metabolic disorders than offspring of unexposed fathers. The research team hopes findings will guide future investigations into how microplastics and even smaller nanoplastics affect human development. The FDA finalizes 4 new recalls for certain lots of Abbott FreeStyle Libre 3 and FreeStyle Libre 3 Plus sensors due to ongoing safety concerns. We told you about this in November when Abbott had said some of its CGMs were providing incorrect low glucose warnings. Internal testing identified the issue: carbon building up in the sensors during the manufacturing process. They found about 3 million CGM sensors were affected. This was US, Canada, and several European countries. When Abbott shared that announcement, the FDA was still reviewing, and no recalls had been finalized. Now, though, the FDA has announced the 4 new Class 1 recalls. Again, more information, lot numbers, what to do, all of that linked up in the show notes. Up next, a new resource for a population at 3 times the risk for diabetes, but without a lot of access to health information. That and more is coming up right after this. From the very beginning, they mean everything to you, and that means you do anything for them, especially if they're at risk. So when it comes to type 1 diabetes, screen it like you mean it. Even if just one person in your family has type 1, you are up to 15 times more likely to get it too. Screen it like you mean it, because one blood test could help you spot type 1 long before you need insulin. Talk to your doctor about how to screen for type 1 diabetes, because the more you know, the more you can do. So don't wait. Visit screenfortype1.com to learn more. Again, that's screenfortype1.com. The first diabetes information website primarily in American Sign Language has launched. The site includes GIFs and videos on, is it GIFs? The site includes GIFs and videos on diabetes management and an ASL glossary of diabetes-related terms. It's called Deaf Diabetes Can Together from the University of Utah Health. Deaf and hard of hearing people are at 3 times higher risk for diabetes, but access to health information in ASL is limited. Insulet brings back its U.S. pod recycling program, now making it available to all U.S. customers. The pod recycling program enables users to request a kit online so they can return their used Omnipods. Insulet then decontaminates the pods before transporting them to a company specializing in recycling for electronics and medical products. Insulet had this in Massachusetts and California, but it's now rolling out nationwide. Novo Nordisk ended all work on cell therapies, including a type 1 diabetes program, in October, but now they have found a buyer. Aspect has acquired rights to the assets and will give Novo an option to re-engage for later stage development and commercialization. Novo is helping bankroll Aspect's development of the asset. The integration will involve the transfer from Novo sites in Denmark and the U.S. to Aspect's Canadian operations. Tip of the hat to Lucas Escobar of Insulet, singled out for the 40 under 40 at Medical Marketing and Media. Escobar is the director and head of U.S. consumer marketing at Insulin. He's responsible for Diasonic, the Marvel comic collaboration, introducing a superhero who uses Omnipod. The Pod Drop, which you hear in this show quite often. It turned the sound of a pod change into a music track. And the Omnipod Mango Pantone, the first color partnership in medtech, quote, honoring the vibrancy of the diabetes community. Escobar lives with type 1 diabetes himself. Full disclosure, we've worked together for years. I consider him a friend, so congratulations, Lucas. Happy to pass that along. And that is in the news for this week. If you like what you heard, please share it. Remember, in 2026, we are rotating every Tuesday with an interview episode one week and the In the News the other. So far, seems like you all like this a lot. Let me know what you think. You can always reach me, Stacey, at diabetes-connections.com, or you can always leave a review on whatever podcast app you listen. I really appreciate that. All right, I'm Stacey Simms. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.
For many of you, as you listen, this is going to sound like a weird question. Why do you use the insulin pump you've got on right now? There's a really good chance that you went on that pump 15 or 20 years ago because it's what your doctor had back then, and you've never really thought about changing. That was us until Benny's Pump Company went out of business, and I was amazed how much things had changed when we looked for a new one. I'm telling you, it is time to take advantage of what's new. If you need a sign to switch, this is it. Omnipod 5, the tubeless automated insulin delivery system, is here, and it's available through the pharmacy, which means that you can try it today, even if your tubed pump is under warranty. Fill out the quick online form, see if you're eligible for a free trial. Go to diabetes-connections.com, click on the Omnipod logo. For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections.